Daratumumab plus bortezomib, melphalan, and prednisone for untreated myeloma. Definition: the combination of bortezomib, melphalan, and prednisone is a standard treatment for patients with newly diagnosed multiple myeloma who are ineligible for autologous stem cell transplantation. Daratumumab has shown efficacy in combination with standard of care regimens in patients with relapsed or refractory multiple myeloma. Daratumumab is thought to work both by destroying tumor cells and by an immune response against cancer cells.
News today that daratumumab has been approved now in the frontline treatment of myeloma, and I think we were all waiting for this to happen. It's almost like a no-brainer, in that we knew that this was a very easy drug to combine, and I think it's really going to augment our treatment for patients in the frontline setting, getting much deeper remissions, hopefully getting them to those MRD negative states that we know have become the new gold standard in terms of therapy for myeloma.
Applications in medicine. In this phase 3 trial, we randomly assigned 706 patients with newly diagnosed multiple myeloma who were ineligible for stem cell transplantation to receive 9 cycles of bortezomib, melphalan, and prednisone, either alone control group or with daratumumab group until disease progression.
Daratumumab is a human IgG-kappa monoclonal antibody that targets CD38 and induces antitumor and immunomodulatory effects. In patients with multiple myeloma that's refractory to standard therapy, the combination of daratumumab and standard therapy has demonstrated both clinical benefit, including prolonged progression-free survival and high rates of tumor response. The utility of daratumumab in patients with previously untreated multiple myeloma remains untested. In this multi-center, randomized, open-label, active-controlled Phase 3 trial, 706 patients with newly diagnosed multiple myeloma who were ineligible for stem cell transplantation were randomized to receive combination daratumumab and standard therapy, bortezomib, melphalan, and prednisone, or standard therapy alone. The authors report the results of the pre-specified interim analysis evaluating the safety and efficacy of the study treatment after 231 events of disease progression or death had occurred. The rate of disease progression or death at the cutoff date was 25.1% in the daratumumab group, as compared with 40.2% in the control group. The Kaplan-Meier estimate of the 12-month rate of progression-free survival was 86.7% in the daratumumab group and 76.0% in the control group. The most frequently reported grade 3 or 4 adverse events in both groups included neutropenia, thrombocytopenia, and anemia. The authors conclude that combining daratumumab with standard therapy resulted in a clinically and statistically significant benefit over standard therapy alone for patients with newly diagnosed multiple myeloma. Full trial results are available at nejm.org.
Pros and cons. Complete response or better occur in 42.6% of those receiving adjuvant daratumumab, but in just 24.4% of those receiving bortezomib, melphalan, and prednisone only. Cons. While supplementing standard care with daratumumab reduced the risk of disease progression or did compare with standard care alone, it also was correlated with more grade 3 or 4 infections.
certainly will change the treatment paradigm. Today, for relapsed refractory patients, we have two major backbone treatment available. One is bortezomib and dexamethasone, the other is lenalidomide and dexamethasone. And I think in the future, when available, the change will be the addition of daratumumab to one combination or the other, depending on the necessity, because if you have a patient who receives lenalidomide at diagnosis, then you switch to bortezomib and you add dara. If you have a patient that receives bortezomib at diagnosis, you use len and add dara relapse. So you have now the ability basically to improve the two standards of care that we have for the treatment of myeloma.
Darzalex is a multiple myeloma is a cancer of blood cells called plasma cells. The cancer plasma cells produce too much protein, and this causes damage to the bones, anemia, elevated calcium level in the blood, kidney problems, and other symptoms. Darzalex is the trade name. Its generic name is Daratumumab. Darzalex is made by Janssen Biotech. Darzalex is approved for the treatment of patients with multiple myeloma who have received at least 3 myeloma treatments. Darzalex is an antibody that attacks myeloma cells and destroys them. It helps to control multiple myeloma and prevent it from getting worse. It prevents damage to the bones, bone marrow, and kidneys. Darzalex is given intravenously every week for 8 weeks, then every 2 weeks for 16 weeks, and then every 4 weeks for as long as it is working, or until it is no longer tolerable due to side effects. A possible complication of Darzalex is an infusion reaction. Symptoms of an infusion reaction are fever, chills, high or low blood pressure, and slow heart rate. If an infusion reaction occurs during treatment, the infusion may be stopped. It may or may not be restarted, depending on the severity of the reaction. Common side effects with Darzalex are mild infusion reaction, fatigue, nausea, back pain, fever, cough, upper respiratory infection, and a low platelet count in the blood. Serious side effects may be a severe infusion reaction, pneumonia, general decline in physical condition, and severe fever. Darzalex may cause fetal harm, so it is important not to be pregnant or become pregnant while taking it. Darzalex is another advancement in the control of multiple myeloma and in our search for a cure.
Issues applied in Ecuador. The National Registry of Tumor of the Society Fight Against Cancer of Ecuador, in its lay statistics, indicate that this cancer is among the first 25 tumors in Ecuador. It is stated that in Ecuador it is low. Multiple myeloma has a considerable frequency, and there are very few publications and information about this disease in the country and the level of Latin America.
News Network, breaking news. I'm Gina Columbus. The FDA has approved Daratumumab in combination with bortezomib, melphalan, and prednisone for the treatment of patients with newly diagnosed multiple myeloma who are ineligible for autologous stem cell transplant. The frontline designation was based on findings from the Alcyone study. In the phase 3 study, Daratumumab plus VMP elicited an 18-month progression-free survival rate of 71.6% versus 50.2% for VMP alone, representing a 50% reduction in the risk of progression or death. At a median follow-up of 16.5 months, follow-up for long-term survival remained ongoing. In November 2016, the FDA approved Daratumumab in combination with lenalidomide and dexamethasone or bortezomib and dexamethasone for patients with relapsed multiple myeloma following at least one prior therapy. For more breaking news, subscribe to email alerts from oncrive.com. Thank you for watching. I'm Gina Columbus.
In conclusion, Daratumumab combined with bortezomib, melphalan, and prednisone result in a lower risk of disease progression or death than the same regimen without Daratumumab.